The three-day Antimicrobial Resistance Conference on the theme Educate, Advocate, Act Now ended with the launch of the Parliamentary Forum on Antimicrobial Resistance. The Chairperson, Health Committee of Parliament, Dr. Joseph Luyonga, represented the Speaker of Parliament, Anita Among.
The Parliamentary Forum on AMR to serve a platform for enhancing Parliament's leadership and oversight role in advocating for additional investment in AMR, prevention and control through political, legislative and community action.
The Health Committee of Parliament now wants strong regulation on drug prescription and dispensation to minimize cases of self-medication.
But we need to look at our operations, our treatment guidelines, and we need to raise the awareness on antimicrobial resistance to the population, to the prescribers, to the professionals, including to the regulators, so that everybody does their docket to ensure that this epidemic is fought against and it is nipped in the bud.
However, stakeholders are calling for more awareness creation for the public and policymakers to appreciate the dangers of antimicrobial resistance.
Coming to Uganda alone, in just 2019, we as a country lost over 7,000 people due to antimicrobial resistance. This problem continues not only to impact, the human health and the well-being of people, but also it has an impact in agriculture, it has an impact on the environment that we live in, and basically it comes from proper use of antibiotics. When people get these antibiotics to treat infections and do not finish their dose, or share medicines at home, or self-medicate.
Which is a looming pandemic because we have about 37,000 people that die due to antimicrobial resistance in the country, and that number is growing, and that's why we've come on board to ensure that we have a response in terms of surveillance, tracking of these antimicrobials, having labs that are well equipped, both for animal environment and human health, but also we're ensuring that there is full funding for this antimicrobial resistance.
For the national antimicrobial resistance, we have called on the policy people to make sure that we take issues of antimicrobial resistance to a high level, so that we work with the different stakeholders from the legislative arm, from the head of state and to the communities to make sure that we address the scourge of antimicrobial resistance. Antimicrobial resistance is a big threat. People have been calling it silent, but of late it's one of the top 10 public health threats.
Health professionals are putting emphasis to curb antimicrobial resistance because it is a threat to the effectiveness of medicines used to treat infections, which can lead to serious health consequences. Adia Nakute, UBC.